Everyone, welcome to today's edition of the Healing Pain Summit. I have a great, very interesting guest for you today. We're going to be discussing how to overcome the pain of cancer and how to recover from cancer. So our guest today is Dr. Nalini Chilkov. She combines her diverse training in traditional Oriental medicine, modern biomedicine, and cell biology with over 30 years in clinical practice. She primarily serves cancer patients who are recovering, as well as those recovering from other chronic illnesses. She is a respected expert in the collaborative integrative cancer care world. She's known as an innovator in building bridges between modern and traditional healing practices. And she's recognized as the go-to clinician for those interested in preventing as well as recovering from cancer. Her practice is located in Santa Monica, California, and you can find her online at www.integrativecanteranswers.com. And she'll tell us more about that later at the end of the video. But Dr. Chilkov, welcome to the Healing Pain Summit today.
Thank you so much for having me, Joe.
So this is a great topic. Obviously, recovering from cancer can be very difficult and can be very painful at times. But tell us just first how you got involved in kind of cancer care, and you now really are the preeminent pioneer of integrative cancer care, kind of combining both the Western and Eastern practices.
Well, like many people, sometimes it's a very personal story. I really got interested deeply in cancer because at about the same time in my life, a little over 30 years ago, both of my parents were diagnosed with cancer. And so that made me really want to help them. But it also gave me the reflection that we really, in our whole family, had this susceptibility to cancer. And at the same time, there were more and more patients coming into my office looking for help. And there's really no health model in traditional oncology. So I've really made an effort to put looking at how to support and protect health and then sustain health just from the minute of diagnosis. And then if you come from a family like mine, you really want to not express the genetic susceptibilities that you have. So then prevention is also a big piece. But that means you have to be thinking about health and healthy function, not just disease, right?
And we know now that cancer is kind of rapidly becoming, in some circles, the #1 cause of death in the country. It's really competing with heart disease and cardiovascular disease. Can you talk about that just a little bit and just shed some light as far as, where we're going? Obviously, the work you're doing is mostly centered around prevention, but also towards those that have cancer and they're recovering. But where are we as far as just the, episodes of cancer in our country?
Well, the statistics are really pretty daunting. In the United States today, 1 in 2 men and 1 in 3 women are expected to be diagnosed with cancer in their lifetime. That's pretty daunting. So if you think you're sitting in a room with 10 or 12 friends, 1 in 2 of the guys, 1 in 3 of the women either has already been diagnosed with cancer or will be. So it's very close to home and will touch us all very personally. And this is primarily due to the toxic environment that we live in. The chemicals we're exposed to, we really are biologically unprepared for that level of detoxification. And our modern lifestyles compromise our nutrient intake. We can't really repair our DNA or protect our DNA. And this genetic material, when it becomes damaged, that's the initiation of cancer. And so if you have a family like mine, that might be less efficient when those stressors and challenges happen. So you have to create an environment inside your body that is inhospitable and not supportive of the promotion and development of cancer. It's kind of like changing the soil in your garden, right? You want to change the soil so that you get healthy plants. You want to change the environment of your cells so that you grow healthy cells instead of cancer cells.
I hope you'll join me for my comprehensive Foundations of Integrative Oncology course, which includes monthly live grand round calls with me where you can ask your questions. You can start transforming your practice today so that you can become the go-to expert who is truly prepared for the rising tide of cancer patients and survivors who are looking for a skilled and knowledgeable clinician who can provide them with the health side of the cancer equation and help them take control of their health and support them through all phases of the cancer journey and beyond. Click on the link below now to get immediate access to all of the modules, print-on-demand patient support documents, and quick reference clinician guides, as well as learn how this course has transformed the way other clinicians like you practice.